Okay, guys, I think I'm gonna start. What time is it? Okay, so I'm gonna start by introducing myself. So my name is Mayssa Moukarzel, and I'm one of Lamsa's ambassador based in Montreal. And I'm a U4 student in anatomy and cell biology at McGill University. Today I'll be talking about psychosis, and here's what we'll be covering today. So, psychosis, what is it? The phases of a psychotic episode, the symptoms, causes, classification, treatment, and how can you actually help, and a small Q&A session at the end. So, what is psychosis? Psychosis is a condition that affects the way your brain processes information. It causes you to lose touch with reality by distorting your perception and thoughts because it causes your brain to take in too much information from the world all at once. So, usually, your brain does a really good job at distinguishing and differentiating between your dreams and your reality and your fantasy. However, when you're experiencing psychotic symptoms, your brain has some difficulty in doing so. And that is why you get confused and you kind of take a break or lose touch with reality. So it's important to note that psychosis is not an illness in itself, but is a syndrome, which means multiple of symptoms, and is often an indication or an indicator that there's something else wrong, that you might have a psychotic disorder, which are psychiatric illnesses such as schizophrenia or bipolar disorder, or severe depression, which is a major depression with some psychotic symptoms. And there are less than 4% that meet the criteria for those kind of psychotic disorder. Psychosis usually first appears in the late teens and early 20s, affecting all genders equally and across all cultures and socioeconomic status. So, usually, a psychotic episode has three phases. The first one being the prodromal phase, where you don't have obvious symptoms during that phase, but you have like early warning signs that we'll see later on. And that can, say to you that you or someone you love is heading toward a psychotic episode. Then you have the acute phase where you have the obvious symptoms and when the individual usually starts treatment. And finally, the recovery phase where the patient is usually under treatment. And it's important to pay attention to that phase so the person does not go into a relapse. And like the symptoms and the duration of each phase varies from a person to another. So, what are those obvious symptoms, the symptoms during the acute phase? You can have positive symptoms. So, positive symptoms are all the symptoms that are going to be added to one's behavior. So, for example, hallucination, which can be visual, auditory, or sensory. So, you can see, hear, or feel stuff that are not actually there. You can also have delusions, which are false beliefs and can be categorized as bizarre or non bizarre. So, a bizarre delusion would be that you believe something that is impossible of happening. For example, that you are God or that you have superpowers. Whereas a non bizarre delusion would be that you believe something that is in the realm of possibility, but that is not actually happening. For example, that your partner is always cheating on you. You can also have a disorganization of thought and behavior, which can be manifested through a disorganization of speech. So, for example, you can have what we call a word salad. So, you can say a sentence that does not really make any sense and it's just random words. And finally, paranoia, which are suspicious thoughts or continuous fear that people are watching you or people want to hurt you. You also have another category of symptoms, which we call negative symptoms, which are all the symptoms that are going to be that are going to lack from one's usual behavior. For example, lack of emotions, social isolation, loss of motivation, restricted speech, difficulty with generating ideas and thoughts, and reduced ability to begin tasks. During psychosis, you can also have something that is called lack of insight. So what is insight? It's the awareness that a person has about a health condition that is affecting them. And the longer a person has experienced psychotic symptoms, the less likely they are to have insight. And this makes it rather very difficult for, family and loved one to encourage someone affected with psychosis to get treatment and get help, because they're always going to be in denial, or they're not going to acknowledge the fact that they have a problem, there is a problem, and that they need to be treated and get help. So yeah, this makes it very difficult. And finally, you have other symptoms which might affect your cognitive behavior, decreasing attention, decreasing concentration, some mood changes, societal thoughts and behavior. Substance abuse can also be a consequence of psychotic symptoms, and sleep disturbances. And all of these symptoms make it difficult for someone who's experiencing psychosis to function normally if they do not get the right treatment and help. So, what are the causes of psychosis? So you can have genetic causes, or you can have other environmental causes, so substances, trauma, illnesses and injuries, or other that we'll see shortly. So let's go deeper into that. Genetics. So you can have the genes or mutation for it. So you can be predisposed to having psychosis. However, and unfortunately, there isn't any genetic testing up to this date that can tell you if you are predisposed to having psychosis. So what people you do usually, or psychiatrists, is that they look at the family history to see if there's any history or antecedent to psychosis within the family. You can also have substances, so excess or abuse of alcohol, drugs, and even prescription medications can all trigger psychosis. So, for example, if you are severely dependent to marijuana, you have an 80% chance of developing psychotic symptoms. For cocaine, it's 80.7%, and amphetamine, it's 100%. There are also some prescription medications, such as some antidepressant medication and some anti-Parkinson's disease medication, that can all trigger or lead to psychotic symptoms, or have secondary symptoms, psychotic symptoms. Trauma can also trigger psychosis, whether it's death of a loved one, war, or sexual assault. They can all trigger trauma. So, for example, we do not have the exact reports or statistic, but we know that after the Beirut blast, there have been an increasing number of reports in psychosis, so following the blast. Also, some illnesses and injuries can have a second effect or secondary symptom, psychotic symptom. So, for example, traumatic brain injuries or general medical conditions such as Parkinson's disease, dementia, so Alzheimer's disease, stroke, and brain tumor. And you have the psychiatric illnesses such as schizophrenia disorder, bipolar disorder, severe depression, brief psychotic disorder, delusion disorder. Also, they can have as symptoms, psychotic symptoms. Other environmental factors, stress, sleep deprivation, and early life environment, like maternal malnutrition, they can trigger psychosis. So, for example, researchers have shown that the COVID-19 pandemic have exposed to people to a lot of substantial psychosocial stress, which increased the cases of psychosis. And now we have a newly named psychosis, which is called the COVID-19 induced psychosis. So yeah, it's very important to know how to cope with stress. So just briefly, what actually happens in the brain? When you have those factors, in the brain, you have a dysregulation of firing and a release of dopamine, which is a neurotransmitter that your brain uses to communicate from one brain cell to another. So having an excess of dopamine, it causes your brain to be overwhelmed and causes your brain to take too much information from the world all at once. And that is when you get the symptoms of psychosis, such as delusion, hallucination, disorganization, etc. So I want to explain a bit more to you how you can get psychosis. So the causes, the factors that lead to psychosis. And in order to do that, I want you to imagine that you or an individual is a jar, okay? And you're going to get psychosis once that jar is completely filled and full. So you can see here that you can already start your life with some genetic vulnerability factor. So with a jar being a bit filled, and then once time passes, and you get exposed to environmental vulnerability factors, it fills up until it is completely filled and filled. And this is where you have psychosis. So it's important to note that the jar can be filled from many different ways. So it does not have to be only genetics or only environmental or the combination of both. So it can be from different ways. So what I mean by that is that having the genes or not, or being predisposed to having psychosis or not is not decisive. So you can have those genes, which mean that you're not necessarily going to get psychosis. Or you not having those genes does not mean that you're not going to have psychosis and that you are safe. But of course, having the genes or being predisposed is going to increase your risk or likelihood of you getting psychosis. But you can get it from like only environmental or only genetics, or again, a combination. Okay, so diagnosis. How do you diagnose psychosis? There are classifications of psychosis, which can be classified as primary, which we usually call the psychiatric psychosis, which comes from schizophrenia spectrum or other psychiatric illnesses that we already mentioned, or secondary, which we call the organic psychosis, which is basically all the other and all the rest. And the diagnosis depends on three things. So first of all, the history of the family. Second of all, the onset of symptoms. So whether it came abruptly or progressively. And finally, the duration of the symptoms. It's also important to note that diagnosing psychosis and differentiating between this type of psychosis is not at all an easy job. And that is why the psychiatrist might change their diagnosis along with the treatment, with apparition of new symptoms or with the reaction to the treatment. So what would be a good treatment for psychosis? A good treatment would be a combination of medication, which is antipsychotic, so usually dopamine antagonist, or support from family, friends, health professionals that are here for you, here to support you, take care of you, etc. Or also, developing a set of skills, which is part of CBT, so cognitive behavioral therapy, where you learn how to cope with stress, have a healthy lifestyle, set goals, and move forward. So yes, the symptoms of psychosis are treatable, and the sooner, the better. So let's go back to our little jar story. Here you can see that the jar is completely full and filled. So the individual or you have psychosis or experiencing psychosis symptoms. Once you reduce that stress and stop drugs, so once you reduce those environmental vulnerability factor, plus start your antipsychotic medication, you are unaffected. And the antipsychotic medication acts as a protective factor. So in fact, it has two roles. First of all, it will decrease the psychotic symptoms. And second of all, it will prevent further psychotic episodes from happening. So even though you might not feeling any psychotic symptoms anymore, you might have to take those antipsychotic medication for a very long time for this protective factor function or characteristic. So as I've mentioned, the sooner, the better. Why? So first, let me explain the first episode of psychosis, which, as its name indicates, it's the first time a person experiences a psychotic episode. So which is often very frightening and distressing, and there's a lot of misconceptions and stigma around it, which increases even more this distress. So it's very important to detect and intervene as soon as possible. Why? Because as I've already mentioned, the peak onset is between the ages of 15 and 25, which is a critical stage of social and psychological development. So detecting the psychosis and intervening as soon as possible will decrease all the secondary problems, so problem with school, work, your relationships, etc., and will enable the individual to continue with their life without many repercussions. And also, the sooner you detect and the sooner you intervene, the less need for hospitalization, the more rapid recovery, better prognosis, less family disruption or distress, less resistant to treatment, and lower risk of relapse. It's also important to note that 1 in 5 people that have experienced psychotic symptoms will commit suicide. So that is why even more, it's very important to intervene and detect it the sooner, the better. Okay. Now, how can you actually help? So you can help at each phase by listening to others and paying attention to others' behavior, especially if they are at risk. So especially if you know that they have a family history, or if you know that they're exposed to a lot of environmental vulnerability factors. So for example, if you know that they smoke a lot of marijuana, or if you know that they just experienced some trauma, pay especially attention to their behavior. And as I've told you, in the prodromal phase, you have some early warning signs that you can detect, and that can be signs that, okay, I am or that person might be heading toward a psychotic episode, such as drop of grades or dropping of school or university, decreased drive and motivation, irritability, feeling down, changes in habits, etc. So ask yourself the right questions. Also, there are researchers that suggest that experiencing what we call a bad trip when you're smoking marijuana might be an early sign that you might be more prone of developing psychotic symptoms, provided that you continue smoking regularly. So yeah, take good care of yourself and stay aware. Now, what to do if you or someone you know is experiencing psychotic symptoms? So here are some tips that you can follow if you're experiencing psychotic symptoms. Try to cope with them, or encourage someone you know to follow them. So first of all, you can distract yourself, and you can do that as soon as you feel the onset of psychotic symptoms kicking in. So you can watch TV, go for a walk while talking with someone, etc. You can also do what we call a reality check. A reality check, you do that as soon as you feel unsure if a situation that happened was real or not. So what you can do is ask people who were supposedly with you in that situation to verify if it was actually true or not. And really, there's nothing to be ashamed of. It's part of healing, and it's part of taking care of yourself. And you can also do something that is called challenge thoughts, where you challenge your realistic vs unrealistic thoughts by comparing them and writing them down. And having a support person or system, I've already mentioned the importance of that. And really, I mention again because it's really important to have a support person, support system that will help you, hear you, be there for you, take care of you. Relax. So you can relax your mind and your body since it decreases stress. And we've said that stress might trigger psychosis. So listen to music, take a hot bath, and relax and just find ways to cope with your stress. Preparation would be when you acknowledge the situation and the people who trigger you or increases your stress. So be aware of them, and you can even avoid them altogether. Medication. So medication, we said that is very important, especially because of their protective factor function, but is not sufficient. So you need to develop a set of skills. And finally, we know that when you're experiencing psychotic symptoms, it's difficult to maintain your social circles. So try to do some efforts and reach out and talk to people, volunteer, I don't know. But also, if you're not the one who's experiencing the psychotic symptoms, just try to listen to that person and understand that it's not personal, and understand that it needs time and a good treatment to heal. And it's okay you want to be there for the person, and even though the person might not want your help right now, just like be there for them and don't abandon them, and understand that it needs time. Okay, so let's break the stigma together. No, you're not a psycho if you have experienced psychotic symptoms. And no, you're not a bad person if you have experienced psychotic symptoms. And that doesn't mean that you're gonna do bad stuff to people. And no, it does not only happen to others. It can happen to you. So please, like, stay aware and be careful. And you can live a normal life with psychosis, provided that you get the right treatment. So I really encourage you to talk to others and reach out. You can go in our forum at Lamsa's website and share your stories, share your experiences, share your feelings, your thoughts. You can do that anonymously or not, or just go there and read others people's stories. And yeah, thank you. Any questions? I'll be staying here if you guys have any questions. Thank you, guys. Hope you liked it.